Hi, my name is Dr. Amy Dayries. I'm a dentist in Roswell, Georgia, and today I wanted to interview Mindy Strich. Mindy Strich is an energy healer, and she completed her training at White Winds Institute in Atlanta, Georgia. And she's been doing energy medicine and energy healing on patients, clients for a number of years now. I have personally seen Mindy for some energy work. It's been very, very helpful, particularly after a recent heart surgery that I had. I got referred to Mindy a few years ago myself by an integrative physician in the Roswell area. And Mindy actually has a lot of her clients are healthcare providers in the area, in the Atlanta area. And like I said, it was made the biggest difference for me after I had a recent heart valve surgery, seeing Mindy back to a place where I felt grounded and back in my body. More and more work and discoveries are being made to support the how and scientifically how for the Western medicine mind energy healing works. But I wanted to take a few minutes since I refer people to Mindy to interview her so you could interview her virtually in a sense yourself, and perhaps you give her a phone call because she does some amazing work. And some of it can be virtually done as well now that we're in the COVID era, so to speak. So without further ado, Mindy Strich, hi.
Hi, Amy. Good to see you again.
Good to see you too. So I appreciate you coming on. I wanted to, maybe you could start by telling us a little bit about yourself and why you became an energy healer.
Sure. Well, as you said, I'm Mindy Strich, and how did I become an energy healer? You know, I often say that I didn't find energy medicine found me, because it was a culmination of things, and I think we all experience this at some level of our lives. Is I had chronic illnesses. What you had was more acute. What I had was more chronic. What doctors could not diagnose what was going on with me for more than 20 years, believe it or not. And so out of desperation, a friend said, why don't you go to an energy healer? And I said, what's an energy healer? But at the same time I was having these physical issues, I was also going through the hardest emotional time of my life, which was an unexpected divorce. So for those of you that have gone through something like that, you know, you feel those emotional traumas in your body as well. So it was a perfect storm. And since doctors could not diagnose what was going on with me, I did go to this energy healer. And I felt like that on top of my divorce, if I didn't do something, I really felt like I was going to die, if not physically, emotionally. So out of desperation, I said, let me take this course, which wound up being a 2-year program. And what I learned there changed my life. And now as a result of that, as a result of my own healing, I decided to become a healer, because what I learned was that whatever is manifesting in our bodies physically, whether it's a heart valve problem, whether it's irritable bowel syndrome, whether it's cancer, whether it's back pain, whether it's migraines, I could go on and on. At the core of it, it's an imbalance of energy. And if we want to take care of our health, then we have to recognize that we're more than physical. We have emotional bodies, we have mental bodies, we have spiritual bodies, and we have physical bodies. And it's not enough to just take care of our physical body by eating right and exercising. Yes, those things are critically important, but it's not enough, because there are underlying issues that are creating or contributing at least to what's going on in our bodies.
If you don't mind me interrupting a little bit, all these bodies you're talking about, this mental, astral, spiritual, these different bodies, can you explain that in layman's terms for people that may not be familiar with energy healing? Because I'm trying to also get to the crux of what is energy healing and what can somebody expect when they come to see you?
Yeah, great question. And believe me, I'm more a layman than not. So thank you for asking that question. Even after 10 years of being in practice, honestly, there are things about it that I don't understand. I just trust it and have seen miracles. So, okay. So if you look at yourself under a microscope, you're going to look very different than if you look at yourself in the mirror, right?
Yes.
So, from my perspective as a healer, at the core of who we are energy. We are millions of molecules, atoms, quantum physical things going on underneath there that's spinning around in space. It's just contained in this thing we call a body.
Mm-hmm.
So we appear solid, but if you break us down the core, you're going to see all of those, molecules spinning in space.
Yes.
Well, this is only part of who we are. There's actually a field that has been measured scientifically that surrounds our physical body, and that's our biofield, our energy field. So you are actually 3 to 4 feet more than what you see when you look in the mirror. Just because you can't see it doesn't mean that it's not there. It is there. And contained within this field, which is what I usually work with, as you know, we've done sessions together, as you said. And most of the time, I'm not even touching your physical body, but you're feeling something, which inherently confirms that there's something there. So stored within this field are your emotions, are your thoughts, and is your soul. We know when we turn on our computers like we have right now and we connect to Zoom on the internet, that we're connected to each other right now, but we can't see that connection.
True.
But there's, I don't know, an infinite amount of information that we're connected to on the internet. And there's an infinite amount of information that we're connected to on the internet.
Yes.
In our field that connects us. So when you're holding on, Amy, to thoughts or emotions, consciously or unconsciously, and most of it is unconscious, meaning we don't even know that they're there. We have thoughts from the time that we're born, and we have emotions from the time that we're born, and they're not in our heads, even though this is where we process them.
Yes.
They're in our field. And if you have enough of an imbalance of thoughts that go something like, I'm not good enough, I'm afraid, or I'm worried that something's going to happen to me, I can't pay my bills, I'm not pretty enough, I'm going to be alone for the rest of my life, I'm not fill in the blank, and we all do it. That energy creates imbalances that our bodies feel. If you're holding on to emotions, again, consciously or unconsciously, because you don't feel safe sharing them and you don't feel safe being vulnerable or telling people who you authentically are, because you feel like you might be rejected or not loved, or people won't understand you, or again, fill in the blank. All of that energy is stored in your energy field, and it creates depletions of energy. It creates imbalances of energy, and eventually that energy becomes solid. We call it pain, we call it illness, we call it disease.
Yes.
It's not a bad thing, it's a wake-up call. So for me, it was that perfect storm, emotional energy and physical energy trying to wake me up.
That makes sense. There was something that also helped me understand what energy medicine can do, or the power of it. I believe there have been some studies on like Gulf War veterans who have maybe lost a limb in combat, and they have phantom pain where they no longer have this arm, but they still sense it, or they have symptoms of this arm. And holographically, they've done studies on these patients. They still have, energetically speaking, an arm there. And they think that maybe why they're experiencing that physical pain. And the energy medicine has helped these people to relieve some of that pain at times. So you're talking about affecting things emotionally, maybe spiritually, but also physically. Energy medicine could potentially have this power to settle. For me, I felt more grounded in my body. But it can be very powerful and work on a lot of levels for a lot of different types of health, spiritual, mental, and physical.
That's the perfect example that I share with people oftentimes about, phantom pain. And I had the privilege and unfortunate situation of working with a 12-year-old client who had her leg amputated from the knee down because of a rare form of cancer. And I saw that work, in real time when I put my hands around the energy field where her physical leg still was. She didn't experience any relief of pain. And this was the day after her surgery. I went to see her at Scottish Rite, and she didn't experience anything. But when I put my hands where there was nothing,
yes,
she wound up falling asleep.
Oh, wow.
And it was unbelievable. I'm getting chills just sharing it again. It was unbelievable that she was feeling relief in where she felt pain in her body as soon as I put my hands there, because the field is still there and it's looking for its physical counterpart that is not still there.
That's
and
mind-blowing.
that it is. And that's why whenever we have surgery, it's my greatest frustration as a healer to convince doctors that healers could really help patients heal by not only helping them emotionally, but we know the body has to heal and the body needs time to heal. But when a surgeon cuts into the body, they're actually also cutting into the energy field. So the energy field needs to heal also. And by working with healers that could facilitate the movement of energy in the field, it allows the body to heal faster. And that's been proven with cancer patients. It's been proven in so many different situations that it helps. And there's no downside to it. There's no side effects.
No, it can't hurt.
It can't hurt. It can only help.
It can only help. So for someone who has never experienced a healing session, Mindy, can you tell me what they can expect when they come to see you?
Yeah, my sessions are a little bit different. So many of the people that are listening to us today may have heard of energy healing, may have heard of Reiki or healing touch, and I've been certified in those modalities as well. And so you can come and do a healing session with me, and you can get on my massage table, and I will, fully clothed, talk to you a little bit more in depth about, what energy healing is at first. And then you will experience what feels like a massage. You may feel some things moving in your body in the way of tingling or some heat. Some emotions may come up. We can do sessions where there's absolutely no talking at all. But my specialty, as you said, I studied at the White Winds Institute of Integrative Energetic Medicine. And integrative energetic medicine takes into account the different fields of energy, the psychological, the emotional, and the spiritual. So for me, the first thing I do is send an in-depth questionnaire to clients before they even come in, and we talk about that in our first session, because wherever you are holding energy in some areas of your life, I believe that it's important that those areas get addressed, and whatever is in your subconscious mind be brought up to the surface so it could be healed. Some of the questions on the questionnaire are things that you're aware of. If you are in a job that you don't like, you're pretty well aware of that. but you may not be aware of how that energy is affecting your life and affecting your body and affecting your health. But there are also other areas that you may not be aware of. And in having a conversation and in going through this questionnaire, that's how I read energy. Like, what are some of the questions are like, how do you nurture yourself? How do you have a spiritual life? Do you express yourself creatively? Are you always putting other people's needs in front of yours? How do you feel about your financial health? Because it's not only about your finances, but it's about how you feel about safety and security.
Yes.
And so on and so forth. So all of those things can come up in a session too, because my perspective as a healer is that I'm not really healing you. I'm helping to facilitate what you need to see so I could work with you to heal. So if you were going to the gym because you wanted to lose weight and you hired an exercise physiologist or a personal trainer to help you, you're using their expertise and what they know about exercise and anatomy to help you lose weight, but you still have to lift the weights.
That's
You
true.
still have to show up at the gym. And that's how I look at my role as an energy healer. It's not a magic pill. That's what's wrong with, I don't want to give Western medicine a bad rap, because
No.
I go to doctors and I think it's very, very important piece of the puzzle, but it's not. I think too many people go to a doctor and say, give me a pill and take away the pain. And I know I did that. But when I went to the healer, the healer that I went to didn't take away the pain. He taught me how to look at my own pain so I
Yes.
could be responsible for healing it. So it's not a magic pill. We work through it together. Healing is not curing.
True.
Curing is the absence of disease. We all want that.
Yes.
And healing can help that happen for sure. But healing is becoming whole. It's recognizing where are the imbalances in my life and what do I need to do to heal them.
One of my understandings too, because you've inspired me, and I've done some training with energy medicine now because it is so powerful. But certain emotional states could be potentially even stored in certain parts of the body. So in one of the clients that I sent to you, it was a man, and they were having some pain in their hand, and they had already been to a hand doctor. And I said, I bet this is a friend, I bet that you were suggested to get several cortisone shots. And if that didn't help this pain you're having, that, maybe you consider a surgical procedure. And they were like, how'd you know? And I said, well, that's what I see with a lot of joints. And that doesn't mean that that's not the right treatment for that person or anyone. But they weren't really excited about getting shots in their hand. And I said, well, maybe you want to go see Mindy. And they saw you, and in just one treatment, they went from having to wear a hand brace like a Michael Jackson or something every day, one glove, to not needing anything. And they later told me that they realized they had been feeling some feelings of isolation, I guess is maybe what I remember them saying. And what I've learned since doing some training myself is maybe sometimes if you're feeling alone, you may not even realize it, but sometimes these revelations come out of these treatments. I don't know, on a personal level too, you've told me some things sometimes that seem to just sort of come to you spontaneously. And you say it's things you're able to sometimes come upon, or that you see in a sense, with maybe not eyes, but it's something you feel about certain emotions. And you've helped me identify some things about myself that I previously wasn't aware of. So that's the power. And you leave feeling very relaxed, like you've had a massage, although you really didn't even touch me. And it was great not to have to get undressed.
Yeah, that's true too. Yeah, it's very sacred to me, as you know. I mean, I'm literally in your energy field, and we are. Let me say this: you don't have to be a healer. What makes what I do different than what every human being on this earth, I believe, has the ability to do is I just studied it and became aware of it. But we're always feeling each other's feelings. We are, you know, you walk into a room and you get a hit about something. You can tell when
Sure.
somebody you love is being honest.
Grumpy
Not that
or honest.
being
Yes.
honest, or they're being authentic, or they're hiding something, or something just feels off. We just have that sixth sense, but we don't pay enough attention to it, and we fluff it off. Well, our minds may fluff it off, but our bodies don't. And eventually, if we don't pay attention to those things, it shows up in our bodies, and in our lives. So not only physically in our bodies, but it can cause divorce and loss of jobs and things like that when you're not listening to your true or more authentic life path. The other thing that I really enjoy the most about what I think I bring to the table as a healer, which may be a little bit different than people who may have gone to other energy healing sessions, is I want to teach you how to do it. I want to teach you how to read your own body, because clients are always asking me, well, what do I feel? What do you feel, Mindy? What do you see? And I'm all good telling you that, but it's not really important what I feel or see, because I may get it right and I may get it wrong. But what's more important is what you feel and what you see. And that says something really important about when you go to an allopathic physician as well. We've gotten so trained to trust what the doctor tells us is true.
Mm-hmm.
Well, this is what you need to do. This is the medicine you need to take, that we trust them more than we trust us. And it's not to minimize their expertise and their education. Of course, you need to take that information into your thinking process of it, your research process, but you're the CEO of your life. And if something doesn't feel right, you need to address that. And too many people listen to an outside source and not listen to themselves.
Yeah.
So I want people to start to tune into their body. So I will ask you, well, what are you feeling? And at first you may not even understand what that means.
It takes a while when you're trained to not to turn out, and you intake all the time. We think of our senses as intaking from outside in, but this is empowering somebody to learn to listen to themselves from the inside out, and what do they want to project to the world. That's, to me, the epitome of what energy healing is. So I had just a couple more questions before we wind up, and I really appreciate you coming out, because a lot of times when I talk to people about potentially seeing you for energy healing, they aren't aware that it's a modality that's very powerful. It addresses things on multiple levels. Can you maybe share with us one of the most miraculous healings that you've personally witnessed? And what do you think might be the biggest thing standing between a person and his or her healing?
Whoa, good questions. I just want to really quickly just tag on to what we were just talking about. That to me is the definition of healing, is unlearning everything that we've learned. So it's simple, but it's not easy. So I'll leave that out there for whoever's listening to this to just sit with that for a moment. In 10 years, I've had so many miraculous healings that I've experienced. So other than my own, I will say that I have a client who has become a dear friend. She's come to see me for probably 7 years on and off.
Mm-hmm.
When I first met her, she couldn't even walk into my office. Her mom had to drive her. She had all kinds of health issues. The one that she specifically came to see me about, and I don't remember the name of her condition, but she was not able to go to the bathroom.
Oh, wow.
And it caused all kinds of toxic backup where she was going to a doctor once a month to have a scope done. Because obviously she couldn't keep those toxins in her body.
Yes.
And what we discovered very soon in our sessions was that she had been in a toxic relationship for more than 12 years.
Wow.
And she knew it, but she was afraid to leave it.
Mm-hmm.
And she's like, I know I need to leave this relationship, but I cannot leave this relationship because I'm going to be alone and nobody's going to love me. And this is the best that I could do. And all of the illusions that her mind was telling her. Within about 2 months, she left that relationship. And she didn't tell me that she left, but she came into my office, started bawling and said, I left. And I was amazed. She said, I left. And within an hour of after I left, I went to the bathroom.
Oh, wow.
As I mentioned, I've known this woman for 7 years, maybe more. She's never had that problem again. She's now married to her high school sweetheart and has a beautiful little boy.
Aw, so sweet.
So that will always stick at the top as my most miraculous healing.
That's beautiful.
What was your second question? Because now I'm just all
That's
about that.
warm glow there. Let's see. How about what's the biggest thing do you feel is standing between a person and his or her healing?
Well, related answers. Fear. Fear is what stands in our way of everything. And then I will couple that by saying that it takes responsibility, self-responsibility. You know, once we decide that we want to heal our lives, we can no longer blame our parents and our husbands and our children and our bosses. It's never about the other person. It's the mantra that I tell my clients all the time. I'm not saying that other people don't do things that may affect you, but this is your healing and your feelings. It's your betrayal. It's your fear. It's your sadness. It's your anger. You have to deal with those things. So it's taking responsibility for your healing. It takes vulnerability to do that. And that takes courage. It takes courage to be vulnerable. And that's a hard thing to do, especially for men. We have not done a good job in this society for men and women, but I'm gonna, have compassion for the men of our world who have been taught not to share their emotions.
Yeah.
At the White Winds Institute, we learned some shamanic work as well. And we learned that in order to get to the soul, which this is all about, you cannot heal if you don't tap into your soul. You cannot. You don't have to believe in any kind of religious God or anything, but there is a higher power that is you. And ultimately, we're trying to get back to source. And the only way to get to that source, that spirit, that soul of who we are at our essence is through the emotions. You cannot bypass your emotions.
No.
And a lot of us are stuck in that. I remember the first weekend hearing from my teacher what a sad woman I was, and I had no idea what he was talking about because I didn't feel sad.
Oh, wow.
I didn't know what he was talking about. Now, fast forward 10 years, I absolutely know what he was talking about. We do a really good job of burying and denying our emotions because that's what we're taught to do. At some point, we teach our children that. But if you think about who we are when we come into this world, that's how we communicate. We communicate by crying.
Yes. There's some basic emotions there: anger, happy, or crying, sad. So do you have any tools or tips for people listening? You know, it might take them a few days to get in to see you. What can they do right now?
The best thing that I could say is to listen to your heart. And what I mean by that is put your hand on your heart
Mhm.
and think, drop from your head, become present to your heart space. And whatever is showing up in your life, just notice the difference. Just notice the difference of what your body feels like when you have something come up in your life and you think it from your head. Notice what you're thinking, and then drop into your heart, which is your connection to your body. When you're in your head, you're disconnected from your body.
Yes.
And your body is your physical expression of all that energy that we're talking about that's in your field. And that's what we have to connect to in order to release it and to turn on the healing powers of the body. We have to be in the body, and your heart is the portal to that.
Very
So that's a
cool.
tool that I use every day, both personally and with every one of my clients.
Thank you so much. How can people contact you for more information?
Yeah, well, they can go to my website, which is www.mindystrich.com, or you can call me 678-642-7771. And I do complimentary phone consultations, so we could talk more about this. And I'm happy to answer anybody's questions. And I'm so happy to have had this time to chat with you, Amy.
I'm
Thank
so
you.
glad you came on. Thank you. Thank you so much. And I will continue to tell people about the work you do. It's very powerful. It's incredible. So thank you so much again for today and your time.
Thanks, Amy. I'll talk to you soon. I'll see you soon.
Okay, take care.
Bye.
Bye.